Have you ever expected that learning will be completely online through calls without attending schools? Have you ever imagined that going for shopping will be cancelled because all the shops are closed? Have you ever thought that your daily system will be turned upside down because of an unseen organism? It is unthinkable, but unfortunately it happened due to a new virus known as COVID-19. Hello, I'm Alaa Zaidan from Bisan School, and I'm going today to explain for you what is COVID-19 and how it changed our lives. COVID-19 is a new kind of coronavirus respiratory infection that first appeared in Wuhan, China in December 2019. The virus was given this name by the World Health Organization on 11 February 2020. This pandemic has affected and is still affecting millions of people around the world who are either sick or being killed due to the rapid spread of the virus. It spreads from individual to another, mainly through the respiratory system route after an infected person speaks, breathes, coughs, or sneezes. A new infection occurs when respiratory droplets containing the virus exhaled by an infected person get into the mouth, nose, or eyes of another person who is in close contact with the infected one. Moreover, it may also spread via contaminated surfaces accelerated by the global passengers travel. The symptoms of this viral infection are highly variable, ranging from none to severe illness, and they may last from 1 to 14 days. Common symptoms include fever, dry cough, loss of smell and taste, loss of appetite, and fatigue. Some people may also suffer from vomiting, diarrhea, bone pains, chills with shaking. On 21 February 2020, Lebanon confirmed its first coronavirus case. Although Lebanon was successful in handling the pandemic during its beginnings, cases began to skyrocket after the port exploded in Beirut on the 4th of August 2020. Lebanon and many other countries tended to close completely for many reasons. First, the lockdown was the only way applied to reduce the infections and the rapid spread of the virus. Second, the medical staff, including the doctors and the nurses who were separated from their families since the first day of the pandemic, worrying from carrying coronavirus, needed to take a rest. Third, the number of deaths due to the virus increased in an unbelievable way and threatened up all the age groups. Coronavirus has fundamentally changed everything: working, learning, shopping, and getting around. The daily routines have been disrupted, and all of us has been separated from family, friends, and work. Working from home has become standard for millions of employees globally, replacing daily commutes and meetings with flexible hours of conference calls. Besides the collapsing economic situations and the crazy rise in prices, lockdowns and quarantines were imposed, although they affect people's livelihood. Sorrowfully, many parents now are not finding money to feed their children and to provide them with their basic needs. Friendships and relationships have been transported to live chats and video calls. Moreover, schools around the world were all off for several months, but then blended learning was dependent in many countries, where students both attend the school with taking precautions and study online through video calls with their teachers. Finally, to avoid the infection in COVID-19, there are 4 steps that everyone should follow. First, wash your hands regularly or rub them with an alcoholic sanitizer. Second, cover your mouth and nose while coughing or sneezing. Third, maintain social distance and avoid handshaking. Last but not least, remember to wear your face mask whenever you get out of the home to protect yourself and everyone in your circumference.